My name is Michael Clemens. Welcome to CGD. More specifically, welcome to Birdsall House, this room that you're sitting in. If this is your first time, many of you, it might be your first time coming to our new home. In last fall, we bought this floor, and if it's your first time coming, please come back soon. We're really happy to have you here. We're here to talk about cash today. You are catching the leading edge of a wave by being here. Cash is going to be, I think, only more important in development policy, development research in years to come, due to a combination of things: emerging technologies, unprecedented penetration of those technologies, hugely accumulating policy experience, and a wave of new research, some of whose creators are here today. Speaking personally, I'm very, very compelled by the idea of cash transfers as a kind of index fund for development that Paul Niehaus and Chris Blattman have been advancing recently. I have had the experience of interacting with prominent and very well-intentioned development projects. I had the experience of learning how much money they spend, sometimes several $1,000s per beneficiary household, sometimes in settings where that is several years of income from hard work for the exact same household. I had the experience of learning that the same projects can't always demonstrate that they're actually achieving some of the things that they say they're achieving. Had the experience of wondering aloud, publicly, how do we really know that with the same, really in context, vast amounts of money, that the same families couldn't have done a lot more, a lot better than the project is claiming to do? And reactions have included scoffing, frankly. But we live in a world where funders have to make hard choices. We live in a world where aid is not infinite. Funding one project means not funding another project. And to me, that makes some of the core issues that we're going to talk about today of aid effectiveness, aid transparency, moral imperatives, really. The people you're going to hear from today are deadly serious about aid effectiveness and aid transparency. That's why they've got their minds on money and money on their minds. We hope we have you for 3 hours. We're delighted to have you here. We want two things from you during that time. We want your ideas. During the discussion portions, please grab the microphones and hit these people with the questions that are on your mind. We also want you to meet each other. Cash is an emerging area in this space. It has a dispersed constituency. In the room right now are a lot of the people in Washington who are interested in this area, as well as really some of the top researchers from around the world. Please don't hesitate to walk up at coffee breaks and give a business card. Amanda Glassman is going to come up and do the real introducing and tell you about some of the speakers. I just want to tell you about one guy, the first speaker, Paul Niehaus. Later I'm going to hand it over to Amanda. So I am really delighted to bring you UC San Diego Professor of Economics and GiveDirectly President Paul Niehaus. You really came to the right place this morning. This guy's one of the best in the business. Here are two genres of person I'd be really impressed with. I'd be deeply impressed with somebody who, say, went to grad school with me and during grad school founded a highly successful international NGO and got invited to write about it in Foreign Affairs. Separately, I'd be highly impressed with somebody who comes out of grad school publishing in the top, most exclusive economics journals multiple times, getting awards from the American Economic Association for the academic quality of their research. It just so happens that that's the same guy. Those two people are the same person in Paul. He's really genuinely a scholar practitioner doing both of those things at a commonly high level and at a very early age, while at the same time somehow managing to be not a jerk, but actually humble and approachable. So I am really looking forward to learning from Paul along with you right now.
Michael, thank you so much, and to all of you here at CGD for having me, and to all of you in the audience for joining. I wanted to start by explaining the analogy that Michael mentioned, this analogy to index funds. So if you will go back with me to the early 1970s, equity investing in the United States in the early 1970s was dominated by actively managed mutual funds. These are organizations that would typically charge investors around 2% of assets under management each year, use that money to hire a staff of analysts who would then look for the highest return investments available, and of course make a lot of money in the process of doing so. There were a few snarky economists at the time pointing out the awkward truth that on average, these actively managed funds seemed, not coincidentally, to return about 2% less than the average equity in the market. And asked why we could not have a simpler alternative that was passively managed, that would charge low management fees and simply invest in the market, a so-called index fund. I think you can sense the frustration in Paul Samuelson's voice by 1974 when he writes this, that at the least some large foundation should create a portfolio that tracks the S&P 500, if only for the purpose of setting up a naive model against which their in-house gunslingers could measure their prowess. Now, fortunately, one of the people who read Samuelson's article and a few other pieces at the time was the young CEO of Vanguard, a man named John Bogle. Bogle read a few of these pieces and became convinced, and went on to create the first commercially successful index fund at Vanguard. Bogle was ridiculed initially by his peers. The fund was called Bogle's Folly. Critics said, why would you want to be average when you could be great, which is what we are all striving to be. And growth was very slow initially, really for the first decade or so, but as you can see, over time it has continued and continued. And index funds now make up around 22% of equity investing in the United States. Because of that, we all have the option as retail investors to do the common sense thing, which is to hold the market at very, very low overhead costs, which is great for me. And it's also put pressure on active managers, either to lower their fees or to show that they can generate excess returns sufficient to justify them. So what does all this have to do with international development? Well, as Michael has said, I believe first that the practice of international development would benefit from having its own index fund, our own naive model against which our in-house gunslingers can measure their prowess. And second, I believe that cash transfers are a desirable such naive model, if you will. I say that fully cognizant that development involves a number of very complex and large-scale challenges to which the application of expertise and planning and coordination are potentially very important. Right? Poor countries lack many public goods. They lack state capacity to implement programs. And it is entirely plausible a priori that in settings where public goods like that exist, we can do more good with a dollar than an individual poor household could do for themselves with the same dollar. I believe that. But I also believe it should be proven. And currently there is very little pressure on anyone in the sector to do so. That is nowhere more true than in international charitable giving, which, as Michael mentioned, is a sector that I've been doing some work in because of GiveDirectly. So this is a sector that exists to solve the very sort of basic problem that I've depicted here, the donor on the left-hand side of the screen trying to figure out what to do to help the recipient on the right. And the system that we have built over the years to solve that problem typically looks something like this. This is the simple version, but we have limited time. So the donor will give to an international nonprofit organization headquartered here in the US. They do some different things. They have some management expense. They'll use a bit of the money for fundraising. And then they will work with a subcontractor, with a local partner in a developing country to implement programming. Those subcontractors have their own management and cost structure, and they'll work in conjunction with the international organization to determine the mix of goods and services that they provide to the poor. So this is the system that we have. To be frank, it's lousy. It's extremely opaque because of laughably poor accounting norms and the multiple layers of subcontracting that are typically in play. We really don't have a clear idea of what anything costs, and it's very hard to figure out how a marginal dollar is going to be put to use. Evidence plays very little role in decision-making in this sector. The number of organizations who have done credible third-party impact evaluation of their work, and even among those few organizations that have done impact evaluation, there are far too many examples that have come back with negative results, results showing that the work was not having a meaningful impact, but that have successfully been able to bury those results and keep them from our eyes so that we're not aware of them. Right? The incentives are messed up. It's a sector where you can win Social Entrepreneur of the Year award for creating a website that loses money, right? Or a website that backs a cause that has been shown empirically not to work. We're not happy with. GiveDirectly, we step back and ask, could we create something, a naive model, if you will, that looks a little bit different? And the model that we've created looks like this. We take money from donors, and we give it to recipients. And that's it. You get it? And of course, there's more to it than this. There is the work of finding those recipients, identifying them, of getting them plugged into payments networks, of monitoring payments to make sure they actually end up in the hands of the people that we wanted them to end up in. And we do all of those things, and we get to use some exciting new technologies that are making field management much more efficient. And at the end of the day, it costs us around 10% of each donated dollar to do this, which means that we're able to put about 90 cents of each dollar directly into the hands of an extremely poor person somewhere in East Africa. Specifically, these folks are living on average on around 60 US cents per day. So the way I would think about that is that if you give your morning cup of coffee, odds are that you can triple or quadruple the standard of living of somebody somewhere in Africa. And I think that's sort of a remarkable fact about the world that we now live in, and very exciting. I mean, by far the most exciting thing that a typical American could spend money on right now. Just an incredible opportunity. So we created this thing, and we think of it very much in our own minds as a benchmark against which we would like the rest of the profit sector to measure itself. Right? And I think we're beginning to see some indications that that could happen, some movement in that direction. It's all very new. We've been around for around 2 years or so. To give you a sense of the kinds of conversations that I'm hearing, in some cases conversations that I'm a part of, we do see people saying, hey, you know what, when we do impact evaluation, we typically compare what we're doing to a control group that's getting nothing, right, to zero. And that's kind of a low bar in a way. Like, maybe we should hold ourselves to a higher standard and say, if we spent $10 million on this project, are we sure we're doing more good than if we had given that $10 million to the people that we're trying to help? You know, maybe that would be a higher standard that we could hold ourselves to. Says Sasha Dichter at Acumen, who I have not met. Jacqueline Fuller, who I've spoken to at length at google.org, similar line. What if every nonprofit that focused on poverty alleviation had to prove that they could do more for the poor with a dollar than the poor could do for themselves? So we're seeing some movement. And we're also seeing people, by the way, people from the orthodox sector beginning to defend the things that they do or the things that they fund relative to this and argue that they can do better. And I don't find those arguments convincing yet, but I am really happy to see people beginning to make them. So I'm excited about that. So that's the charitable sector. Let's move and think about aid a bit more broadly. Right? There are many differences, right? The institutional sector, institutional aid from the small charitable donor, but I think the point of commonality is this, and if there's one thing that I'd ask you to do as homework after today, it's to go and pick a few of these big public aid projects and try to convince yourself, based on the available data, on the available evidence, that these things have done more good, as Michael said, than handing the money over to the poor. Right, that's an exercise that I have done in a number of cases and for projects that I've worked with or been associated with. It's something that folks here at CGD have done, and so I've pulled one example here, from Haiti. Vijaya and Julie did some work trying to catalog all the money that was spent in the first 3 years after the earthquake, and then ask what we know about how it was used. And the numbers they came up with were around $6 billion in public sector funding, most of it to NGOs and to contractors working in Haiti. That's, for reference, 27% of Haiti's GDP over that time period. So the benchmark we're talking about here is we could have increased the income had we gotten that money into people's hands of everyone in Haiti by 27%. And the question that I want to ask is, are we confident that we have done more good than that with the things that we actually spent the money on? And in this case, it turns out the bottom line, as they say, is that we really don't know very much at all about how the money was spent based on publicly available evidence, let alone on whether it was more effective than a 27% income shock, right? So they find 196 organizations that receive meaningful contracts as part of this reconstruction work, and they're able to find reports that detail what those organizations did with money in 4 cases, right? Which seems abysmally low to me. So I find these things depressing. I mean, as a taxpayer, some of that $6 billion is my money, and it doesn't feel to me that we are yet making a convincing case that we're doing more good with it than the poor could have done themselves. But of course, we haven't historically asked that question, right? It's not a question that's been front and center on the radar in international development. I think there are a few reasons for that. I'm going to talk about a couple of them. One is that historically we have had these concerns that poor people are irresponsible or perhaps just simply too focused on present needs, right? Too taken by the demands of the day, which are very real. Kids who aren't getting enough to eat, maybe a sick relative, and not focused enough on the future, so that it isn't realistic to think about them doing things with money that are really development, right? Really long-term progress out of poverty. That's not a crazy hypothesis by any means, But it is inconsistent, in my view, with the evidence that we have obtained on cash transfers over the last decade from a very large number of high-quality empirical studies. We know more, I would argue, about cash transfers now than just about any other intervention in development. And across dozens of these studies and across dozens of these contexts, one, I'd say that consistently the evidence has been that poor people put money to use in reasonable ways that make their lives better. There isn't evidence of systematic squandering or waste. And two, that in many of these cases, there's evidence of poor people using one-time transfers of money in ways that are going to have sustained long-term impacts on their lives. And sometimes that's monetary, right? So Chris Blattman's work in Uganda got a lot of attention this year, showing that 4 years after people received a one-time infusion of cash, their incomes had gone up by around 40% of the amount transferred, right, which is a very attractive rate of return, right, something that a gunslinger would feel very happy about. We have similar results in terms of long-term income impact from one-time transfers in Sri Lanka, and some evidence as well from Mexico. In other cases, the impacts are not monetary, right? So GiveDirectly did an impact evaluation collaborating with Innovations for Poverty Action and found that one of the things a lot of people invested in were durable housing materials, in particular putting metal roofs on homes that had previously been built out of thatch. Not something I had ever thought of as development. Turns out if you work out the rate of return on these things, you save money every year because you don't have to buy a new thatch roof, and it looks like it's about a 20-25% rate of return on investment every year. So not a bad thing to be investing in, and not a short-term thing. Right? And there are other examples that are even less obvious. I think nutritionists and public health researchers would tell us that investing in 0 to 5 nutrition for kids is probably one of the highest return long-term investments that a family could make, and yet we often think of spending on food as short-term, as palliative, right? As something that isn't going to last. I think that might be a mistake. In any case, this is the evidence. It doesn't say that poor people are perfect. It doesn't say that they know everything that we know about science and engineering. But to me, it says that they cannot be dismissed as candidates to manage their own money. I think the second concern that we might have and might very reasonably have is that even if we like the notion in the abstract of cash transfers as a benchmark, they are just too hard to implement in practice. And I'm very receptive to that. I've spent most of my professional life trying to get money into the hands of poor people, and I agree it is not trivial. Right? It may be easier than many of the other more complicated things that we sometimes aspire to do in development. It's certainly not easy. But it is being done right now on a very large scale. So the most recent estimates I've seen come from DFID in 2011, who estimate that about 1 billion people in developing countries at that point in time were receiving some kind of cash transfer from their government. And if it's hard, it is also getting easier in part due to the technologies that Michael mentioned. Right? So GiveDirectly operates initially in Kenya, where we have access to this incredible mobile payment system, M-Pesa, which I've depicted here. Right? This is a system which has now reached, as of the last numbers I've seen, 90% of Kenyan adults who say they've used M-Pesa at least once. And it means that once we have someone's phone number and can upload that number into a website with the amount of money that we want to send them, we can get money via SMS to folks almost anywhere in Kenya. So it's an incredibly exciting technology and an incredibly exciting new opportunity for us. And Jenny Aker, who's going to be here speaking in a bit, has done exciting research showing what the impact of delivering cash using this kind of technology is relative to older, more traditional delivery methods. So we're learning about that as well. Now, of course, not every country has mobile money, and not every country has it anywhere near as developed as Kenya has. India would be a good example. But in India, there are other new technologies that are rolling out right now, which I think will have similar effect. I've had the opportunity recently to work with the government of the state of Andhra Pradesh on an evaluation of a payments technology that looks like this, like what you see here. This is a woman who is collecting payment for her work on the National Employment Guarantee Scheme in India. And she's doing so by putting a card that's a smart card into this machine and then scanning her fingerprint to authenticate and to prove that she is who she says she is. This machine is going to then say how much money she's supposed to receive, and it will actually, in some cases, it will actually also read that amount out because she's likely illiterate and wouldn't be able to interpret a receipt, but she can understand if the machine says you should be getting 500 rupees, and she'll know if that's different from what she actually gets. So none of these things are fail-proof. Right? We've studied this over the course of 2 years with the state of Andhra Pradesh, and we found enormous obstacles to implementation, huge logistical barriers. Naturally, the people who are losing money that they were making corruptly before are pushing back and doing everything they can to fight the rollout of this technology. But the bottom line is that we've seen large reductions in leakage from these programs, and also significant improvements in folks' user experience. They're collecting their money faster, it's more predictable, and overall 90% of the people using it say they prefer it to the old system. So there is really exciting progress on a number of fronts, whether it's mobile payments technology, whether it's using better forms of authentication, that are making it easier, right, if not easy in an absolute sense, to deliver money directly to the poor. I think the last thing I wanted to touch on is that, if some would say that this idea of cash transfers as a benchmark goes too far and is a bit aggressive, others might say that it doesn't go far enough. That what we should really do is pick the best use of every single dollar, and so there should be no one benchmark. Nothing should be especially privileged. We should just compare everything to everything and do the thing that's best for the poor. And I completely agree. That is exactly what we would want to do in a perfect world. The reality is that we live in a world in which, at very best, and after a lot of work, we have convinced some people to compare the effects of what they're doing to nothing, right, as Sasha Dichter said in that quote. So the typical scenario, and a good scenario here, would be that an organization that's, say, distributing livestock would run an impact evaluation where they compare what happens when you give people money to what happens when you do nothing at all, and ask, whether giving people livestock is a good thing and how big those effects are. So that's certainly progress, but we would love to benchmark these activities against something that's a slightly higher bar than nothing, to move from nothing to something. And so in my mind, the question is not, can we do the thing that's optimal? Can we make every decision completely evidence-based and systematic? But can we introduce a slightly higher, lower bar? And what would that something be? And I think that there are at least 5 reasons why cash transfers are a logical something to begin with. And I wanted to lay those out for you. The first is that they are relatively simple. Not simple in an absolute sense, as I've said, but of all the things that we can try to do in development, I think this is the one that we are least likely to screw up terribly. Which is not an incredibly enthusiastic statement, but that is really what I think about the world. The second is that they are broadly relevant. And to show you what I mean by this, imagine that instead of proposing cash transfers as a benchmark to you, I was proposing something more specific like, say, bed nets. Right? I think there are settings where bed nets are going to be an incredibly exciting high-return investment, where there is severe malaria and big externalities because of the sort of infection mechanisms, and investing in bed nets is going to be one of the highest return things we could conceivably do. So in some places, they'll be very exciting, but of course there will be other places in which they would be completely irrelevant as a benchmark because there's no malaria, or because we've already given out so many bed nets that people are starting to use them as grocery bags or as fishing nets. Right? So the advantage that cash has in this regard is that it may not always be the best thing in any given context, but it is always likely to be of some use, definitionally, because it is the most flexible thing that we can give to people. Third point is that, at least for me personally, I find cash transfers redefinitional in a helpful sense. And what I mean by this is that uniquely among the things that we could give to poor people, when we give them money, we learn something about what they prioritize, what they care about, by seeing what they do with the money. And I find that a very healthy exercise in the sense that I can then compare that against my own definitions of success for a project or my own definition of development and ask whether there's tension, whether I should reevaluate my own definition. Fourth is this point about discipline. I said up front that we all agree there are public goods and large-scale problems out there that we could potentially focus on, but I think we need a disciplining device that gets us to articulate that focus, to say the reason that we are taking on this project is not because education is good or health is good, but because these are public goods in education or health that we don't reasonably think poor people could provide for themselves. I don't see people making that argument all that often today, and I think it would be good to see it being made. And then the fifth and final point is just that it does seem to me, in my own limited experience of the world, to be working a little bit. And I'd even put forward the fact that we're all here today having this conversation about cash as a benchmark and that we're not talking about some other thing as a benchmark as evidence that there is something powerful about that idea that the dollar I'm spending today could have been spent by a poor person instead, that has resonance, right? That forces people to think. And so I would love to see us ask that question more. I think it's a very healthy exercise, and look forward to hearing from the rest of the panelists whether they buy it. Thank you.
Great. Thanks very much, Paul. I'm Amanda Glassman. I'm a senior fellow here at the Center for Global Development, and I'll be moderating the rest of this panel. And I'd like to introduce our first round of discussants to take their seats on stage ahead of what we'll call a debate. So only the pro side, if you could come up now. This is a topic of particular interest to me. When I worked at the Inter-American Development Bank, I worked on Mexico's Oportunidades and Colombia's Familias en Acción cash transfer programs. Paul's talked a little bit about the impact that they've had in a number of different dimensions. And so today we'll ask, when are cash transfers better than traditional foreign aid? And I think we'll expand the discussion beyond just non-governmental aid and also to talk about government and anti-poverty programs. And we'll go beyond some of the small-scale experiments to talk about some of the larger-scale interventions that have been going on over time. So we have 6 panelists in total. I'll tell you a little bit about the format. This is going to be a court-style inquisition rather than a traditional debate. Not the Spanish Inquisition, but a series of questions and answers. And our panelists, we've asked them to take a little bit of a polarized position, not because that reflects their actual views, but because we would like to have an entertaining discussion. So don't attribute all of what our panelists would say today as their personally held beliefs. Our 3 panelists will give short opening arguments in favor of benchmarking aid interventions against cash transfers and saying why they think it's a relevant and feasible approach. We'll have some time, and then we'll have a little coffee break, and then we'll come back and start with the inquisitioners. And I'll introduce them later, but I'll tell you a little bit about our first round. On the far left-hand side, representing Fletcher School and Department of Economics at Tufts University, she's an assistant professor, and she's also a non-resident fellow here at CGD. She'll be followed by Sudhanshu Handa. He's the senior social policy specialist at the best job, I think, in the world, the UNICEF Innocenti Research Center, based in Rome, but it hasn't always been that way. Florence, even worse. Okay. And he's also professor of public policy at the University of North Carolina and head of the Transfer Project, which does a number of impact evaluations on cash transfers. And then in the middle, rounding out the team, Jishnu Das, lead economist on the Human Development and Public Services team in the Development Research Group at the World Bank. So thanks very much. We'll start with Jenny, we'll follow with Ashu, and we'll end with Jishnu. Go.
So Good morning, ladies and gentlemen. You've heard from Paul this morning how cash transfers can be a cost-effective way to alleviate poverty, that if the poor are provided with cash transfers, they're not necessarily investing in so-called temptation goods as we might fear, but rather they're making informed choices about their own well-being and the well-being of their families. Now, I'm here to provide you with what I think are 3 additional arguments as to why we should use cash transfers: choice, cost, and corruption. So basically what I wanted to focus on a little bit is that for most of us who are sitting in the room, we ask this question about how wealth should really be redistributed to the poor. Should it be cost, or should it be cash or credit? Should it be cows or corn? And if you focus on what the poor want and what they need, from the program recipient's perspective, they would prefer a cash transfer as compared with an equal valued in-kind transfer because it gives them more choices. So to make that idea a little bit more concrete, suppose that your mom can give you a $37 in cash or a $37 gift card to Starbucks. Now, obviously, if you have the $37, you can spend it on whatever you want to. But if you get the gift card, you have to spend it on coffee and food at Starbucks. Now, if that $37 is less than what you would normally spend at Starbucks in a month, you're going to treat it just like cash and be just as happy. But if that $37 is more than you would actually spend on coffee and food in Starbucks in a month, you're going to have to start spending more on coffee than you would normally just to use the full value of that gift card. What that means is that you're starting to change your consumption patterns, and you're not necessarily getting what you want or what perhaps you actually need. And when you talk to kind of focus on the example of Niger, going back to rural areas, suppose that you're a poor person who's living on $1.25 a day in Niger. That's about $37 a month. It's currently the hungry season, and so an NGO can give you a bag of grain. Are you happy with that bag of grain? Well, probably. Would you have been happier with cash? Well, it really depends, but you potentially are because you can use that cash to buy the grain and the other things. And some of the work that we've done in Eastern DRC with Concern Worldwide has shown that when you actually ask the program recipients what they prefer cash to in-kind transfers because it gives them greater flexibility. Now, I can see you all thinking, but, Jenny, these transfer programs aren't just about individual happiness. We live in a society, we're using public resources for these types of things, and maybe someone else's consumption choices are going to have a negative impact on my own. But I think what Paul alluded to and what Ashu is going to talk about as well is that when cash transfers are actually provided in many developing countries, even unconditional ones, the poor are making smart choices. What I mean here is that they're making choices to invest in their own well-being, and we're also seeing that they're yielding improvements in things that we might care about, like health and education and incomes. So if cash transfers provide greater flexibility and the poor would be at least as happy as compared with an in-kind transfer, are we getting more bang for our buck? And Paul alluded to this a little bit. Empirical evidence focusing on some studies that IFPRI and WFP have done suggests that actually cash transfers are $2 to $8 less expensive than equivalent in-kind transfers. And here they were really looking at food. Now, that's quite important, not only because we're living in an era of budget scarcity, but because that money could have been used actually for other things. And if I go back to our DRC example, if in-kind transfers had been transferred to actually cash transfers, we could have served an additional 300 households, which is an additional 1,500 people. You could extrapolate that up as well. So the final thing I want to focus on is this idea of corruption, and Paul alluded to this as well. Now, often cash transfers are criticized for being kind of more threat and vulnerable to corruption. We've seen that that might not necessarily be the case with the advent of these new technologies. I would make the argument that any type of development aid is kind of vulnerable to corruption. But I want to focus on something a little bit at a lower level, which is what happens to that money after the recipient actually gets it. Are they vulnerable to theft from other members of the community or other actors? Again, cash is often criticized as being kind of more likely to be stolen, but I would make the argument that in many cases, in-kind transfers are more observable, more difficult to hide, and potentially easier to steal, which is something that, again, we saw in Eastern DRC. So you can put cash in your pocket, but you can't necessarily put a cow in your pocket. So it's with these three arguments about cost, choice, and corruption that I'd like you to strongly consider the proposition that cash should be our benchmarking for foreign aid. Cash is king. Thank you.
All right.
Cash is king. Cost, choice, and corruption. Can you do better, Ashu? Let's see. Can you
Okay.
put up Ashu's slide, please?
I'm going to give you an example of why cash is king. As Amanda mentioned, the transfer project, I've been involved in a project for the last while, 4 or 5 years now, that works with national governments in Africa to evaluate the impact of national programs. So everything that we do on the research side is with national programs executed by governments. Here is just one little juicy piece of evidence from one program. And I picked this program because I think this could be the exact kind of program that you might benchmark against, in the sense that it's a very, very easy program to implement. The targeting is very easy. The whole idea is incredible in simplicity. I'm talking about the Zambian government's child grant program. It's a flat transfer, so it doesn't depend on household size. It's categorically targeted to households with a kid under 5. It's geographically targeted to the 3 poorest districts in Zambia. That's it. Bingo. That's so easy, right? It is implemented by, the relevant ministry. We ran a social experiment, an RCT, on this program over 2 years. These are the impacts after 24 months in this program. It's shocking the range of impacts that you see. Okay, and so here you have to sort of start from the bottom, and I've kind of listed for you. Everything I've listed here is a significant impact on an indicator that's listed on the y-axis. There are others, but there's not enough space. Amanda gave me one iconic slide. She said I was allowed one slide. So this is it. But let's just start from the bottom. So these are 24-month impacts, and all of these are percentage of baseline mean, and some of these are above 1. If the impact was above 1 in terms of percentage of baseline mean, I just trunked it at 1. Okay, so let's start from the bottom. Consumption. Diet diversity, food consumption, the poverty gap, interesting, which is interesting to the Ministry of Finance in some sense. Subjective well-being, future subjective well-being. Okay, so that's sort of your welfare poverty side of things, subjective and objective. Again, the program is targeted to households with young kids. So let's look at some of the young kids' outcomes. This is an unconditional transfer. Literally, you're handing $12 a month to a family that has a child under 5 in the 3 poorest districts of Zambia, right? No conditions or anything. Diarrhea, infant and young child feeding, stunting, there's an asterisk there because that's only for households with mothers who have completed primary school education, okay? So not on the whole sample. More books, okay? We had an ECD module, so more books amongst these families. Moving on now to the productive, or what we call the livelihood diversification. Massive increase in non-farm enterprise. Yes, indeed. Savings goes up. Chickens, goats. Yes. Moving on to crop production and the actual agricultural side. More hoes, more purchase of fertilizer. Look at the fertilizer. It's trunked at 1. Crop production goes up. Value of sales, so more participation in the market. And then finally, there was a local sort of a study on the local impact, the local economy effect, so the multiplier effect. And what that red bar is showing you is that for each kwacha, in this case, for each dollar, whatever unit of currency transferred, there is an additional spillover effect of 0.79, right? So that's the local economy effects. So again, if we're going to benchmark against something, this is a simple program. The targeting is incredibly easy. It's done by a ministry that is incredibly weak in Zambia. If they can do it, any country in Africa can do this program. These are the effects of this ridiculously simple program. It tells you what households actually care about, right? If you and I were going to do it, we might condition on all kinds of silly things like sending your kids to the hospital or sending them to the... There's literally no full-time doctor in any of the clinics in these districts, all right? 30% of the clinics have oral rehydration salts. So conditioning on something like that, this is what the households care about. Now, are they wasting their money? Is this a bad investment? I'll let you be the judge. Thank you.
Woo. Okay, good. All right. Now we will turn to Jishnu.
Sure.
Go ahead.
So I'm in the unfortunate position where I'm aging, and I think
Like as we speak, is it green?
More than others in the room?
hey, and I think the 2 things that's happened with age is, one, I realize I cannot, I'm nowhere positioned to do the kind of solid, good empirical work that we are seeing coming from Ashu and Jenny and Paul. So I've given up on that. And the second thing is I only, I've gone back to remembering only what I learned in my first undergraduate class. And so anything beyond that seems very difficult for me now. And the first thing I learned in my undergraduate class was there were 2 theorems of economics that were vital to understanding virtually everything about how we thought about government action. And that's why we call them fundamental theorems. And the first fundamental theorem said that things work. Okay? Things work in the sense that if you take a market and you let people do what they want to do, you cannot do better. Right? That was called a first fundamental theorem of welfare economics. And the reason you couldn't do better was because everybody was already trying as hard as they could to do better. Right? The second theorem said, well, you might be worried that people are doing better, but the poor are not doing that well because they don't have the money. So the second theorem said, take anything you want, you can get there by redistributing cash to poor people, right? That was a second theorem of welfare economics, and this was about 150 years back. So I'm glad it's back on the table, because under our most fundamental precepts for how you define the limits to intervention, the most fundamental precept was you always give cash unless there's what we used to call a market failure, which was essentially of two types. One was when I take an action, I don't take into account the effect it'll have on somebody else, or I don't take into account the effect it'll have on myself in the future. I cannot commit to doing something. Right? So what's happened? So the second part of my my aging has been that I now increasingly look for policy issues that cannot have an empirical resolution. Right? And the advantage of not having an empirical resolution is you really have to go back to what were the fundamental issues that were raised 150 years back and argue from that, right? So let me tell you why I think that is particularly important in this context, and why I think you should think hard about it. It's going to turn out that the empirically non-resolvable issue in this whole debate is going to be, we can never tell whether cash is better than something else, right? The reason you can never tell whether cash is better than something else is going to be because cash is always going to be better than anything that is non-cash, right? Because people are going to use it in the way that they want to use it. Right? In fact, we had an entire generation of papers from 1970 to 1990 that basically used to compare the deadweight loss of an in-kind transfer. So the entire literature from 1970 to 1990 was cash is king. When you give something in kind, there's a deadweight loss because people are not able to do what they want to do with it, and how big is that deadweight loss, right? So the reason I don't want to allow that benchmark of did the cash improve the education is because in 2 years from now, somebody is going to come up and say, well, it's not really alcohol we're concerned about, it's sugar intake, right? The next thing they're going to say about that is the problem is that when you give people cash, they buy shoes, and that's really bad, right? So I want to make very clear that you can only say that cash is doing worse than something else if you are willing to say what that something else is. And the intellectual sophistry that's going to come from that is, it is not, be very careful about it, because the moment you take that stand, you are going to take the stand that you do not respect the judgments of the poor. So be very careful that you're never going to say, I'm for empowering the poor, I'm for respecting the poor, and I'm going to dictate what their preferences and what their welfare is going to look like. So that's the first intellectual sophistry you need to be very careful about. And essentially, this is going to hark from what I call a pep talk, which is it's coming entirely from Prohibition-era politics. Right? So be very careful of the intellectual sophistry in the pep talk. The second part that is never going to be empirically resolute, there's going to be no empirical resolution, is there's going to be a crowd of people who are going to say, well, cash is great, but it's not really implementable, right? You could twist Jenny's words and say, well, you can't put a cow in your pocket, but the guy could put cash in his pocket, right? It's again going to be intellectual sophistry for the following reason. Take schooling, right? In the US, there are two crowds. There's a crowd that says schooling sucks, right? We should get out of it and give it over to charter schools or private sector. The other crowd says schooling sucks, we need to give it more money, right? And that's a fundamentally there's no resolution to that problem, because we are never going to have the counterfactuals on either side, right? So the only way you can move forward on that is deal with the theory, tell me what it is about the choices of the poor that you disrespect so that you do not want to give them cash. If we agree that theoretically we want to give them cash, the onus is now on us to say if the implementation is poor, it is our job to improve the implementation, not exit from that task, right? So any argument that the implementation of giving cash is poor, your counter argument has to be yes, it's poor at the moment, and we will improve it, right? And Paul is modest to a fault. And his modesty in this case is he doesn't talk about the fact that they're continuously improving and experimenting with the way they deliver the technology on how they do this, right? So it's entirely possible that we'll move ahead, right? And the one example I do want to say, the piece of empirical evidence, was relative to Haiti, right? The big Pakistan earthquake happened in 2005, and I worked on it a lot. We did two big programs. We gave cash to people, and we gave housing grants to people, which is, again, cash conditional on you doing something which is apparently earthquake resistant. And we fought tooth and nail to say it should not be conditioned on whether your house is earthquake resistant, because people are actually more risk averse after the earthquake. They're making them inefficiently earthquake resistant, right? But they did it. 4 years later, we did a survey. Everybody got the money. This was Pakistan, in Kashmir and NWFP, where our surveyors were kidnapped, where we had to have massive dealings with everybody. Everybody got the money. So the argument that it's not implementable has to be responded to with the fact that if it's not implementable, we have to make it implementable, and we can, right? My final point is going to be, I don't want to leave you with the thought that there is no argument against cash. So let me tell you. Hold on. No, so let me tell you the one piece that for where empirical evidence might count, and which they won't have because it doesn't exist, right? Which is that there's something stable about the political system that makes delivery of cash impossible, right? That's the one argument that you could perhaps bring to the table, and that doesn't exist yet, because we can, if it comes to the debate, we can give examples of the examples about where the political system has actually given out cash left, right, and center, and would love to do so. So let me stop there.
Okay. No ammunition to the other side. Come on. Okay, we're going to take a quick 5-minute coffee break, and when you come back, our inquisitors will join us. And thank you to this first round of statements.